really respect the commitment we made that we'll try and get the fortnightly updates from the minister. That is what we have today as an item. You will guide me, Ms. Machalambe, if there's any other item except for our minutes, one of them outstanding from last week. But just to thank that team that is working very hard to always find that we do have sit in these meetings. May I request honorable members, not very often, that we start with a moment of silence to respect one of our colleagues, Mayor Jackie Mofokeng, who was laid to rest yesterday with her daughter. A very tragic incident. A day before she passed on, she lost a daughter, and then the following day, she also succumbed to COVID-19. Just a moment of silence to remember her as a member of parliament of the African National Congress, and also one of us. But remember all Africans that we have lost. Some of you have probably lost immediately family members, close relatives and friends. Just a moment of silence for that. May the souls of our departed colleagues, comrades, friends rest in eternal peace. Thank you very much. Yes, can I now take us back to Ms. Machalamba? If you could, one, indicate the attendance of this meeting from the portfolio committee, and then also apologies if there are any from the portfolio committee members. Ms. Machalamba?
Morning and thank you, Chair. Present is Dr. Dlomo, Mr. Munyai, Ms. Gela, Dr. Jacobs, Dr. Harvard, Ms. Wilson, Ms. Ishmael, Dr. Tembe Kwayo, Mr. Van Staden, and Mr. Imam Sheikh. I've received an apology. The apologies are as follows. Ms. Kwahube is attending another meeting. Ms. Chirwa is not well. Ms. Sukers is attending a meeting with basic education. And Mr. Imam Sheikh would like to leave the meeting early. Thank you, Chair.
Okay, thank you very much for that. I now recognize the presence of the Minister and the DG, Deputy Minister, and some of his delegations. Thank you very much, Honorable Minister. You always try and find time to come and update us. You updated us a fortnight ago, and you were very detailed in some of the things that were worrying us. But of course, some of them is work in progress, and we made a specific request that among other things, we need to be updated about your vaccine, or the other ones that are outstanding, Sinopharm and Sputnik. But also we are excited to learn that you are now restarting today. You'll tell us the reasons why we are restarting. We always indicated to us that it was not going to be a very long suspension. Of course, you need a scientist to guide you and give you a heads up on that. And any other processes, your readiness then to go to provinces. And also the update on the new, on the 60 years and above, who have actually now registered, how the registration process. I think that is the main item, honorable members, that we are in for. And then thereafter, we may deal with our in-house programs. I will request that honorable members, because we have had this presentation with us for some hours, I missed it out to sit yesterday well. I'll be taking your hands for clarity seeking questions, comments to engage the minister as they start with their presentation. Honorable Minister and your team, I now hand over to you. Oh, I do notice that there are hands already before we start. Honorable Imam Sheikh, you want to be number one? And then Honorable Van Staden, let me take those two hands before the minister starts and hear what they are saying.
Thank you very much, Chairperson, and welcome to the Minister and his team. Chair, I'll be boarding a flight in about 40 minutes' time, but I have sent some written questions, so if I'm not able to pose those questions, if you could please entertain them. Thank you very much.
Did you send them in our group?
Yes, Chairperson, I put them on the group, yes.
Okay, thank you. You'll be number one. I'll read them for you. Thank you.
Thank you, Chair.
Honorable Van Staden.
Morning, Chairperson and Honorable Minister. Now, I was just raising my hand here as well as on a WhatsApp group, but I do have questions after the Minister is finished with his presentation. Thank you, Chairperson.
Okay, still send them. We must still send them in our group. Thank you very much. You'll be number two after I've read the Imam Sheikh's questions there. Okay, thank you. Honorable Minister, back to you now.
Thank you very much, Honorable Chairperson, the members, honorable members of the Portfolio Committee. Thank you very much, and to the Deputy Minister, Director General, and senior officials of the Department of Health and Media, and the public. Firstly, let me again once again indicate my appreciation for the opportunity to share some of the issues that relate to the vaccine rollout program. There are times when there'll be lots of details. There are times when there will not be a lot of details. Just depends where we are with the process. Last week we spoke to respond to. Let me start by therefore indicating that a number of the issues that I'd raised were actually since cleared. The issue that related to the contracts with Johnson & Johnson, we had a whole discussion about it. The matter is resolved and the contract has been signed. At this point, we are expecting 31 million vaccines from Johnson & Johnson, and there'll be a bit more detailed breakdown when the Director General presents. With Pfizer, similarly, we have also concluded the contract. We have 30 million vaccines already confirmed, and so we will be showing you some of the details at that level. Now, the other issues that are worth responding to, we are finalizing this list. We're not ready for it to go to public as such, but we have said that it can be shared on a confidential basis with the members of parliament, just for them to understand where we are. But we've got a lot of cleaning up that needs to be done. It's a pretty rigorous process. So we hope that members will have a look. It's a very complex spreadsheet that has to be sent around. And so we're not ready for it to be published, but we're ready to share just for the information of the members of parliament, if they can keep it as confidential for now, so that it doesn't cause confusion in public. Sometimes we've got information which, whilst it's not secretive, but you want it to be cleaned out before you have to publish it, so that it doesn't create unnecessary confusion. But nevertheless, we have said that we've got over 3,300 sites for vaccination, and we'll talk a little bit more about that. Then we have also asked that the heads of department working with private sector must work now on the tentative allocations to every province and to the private sector. We'll not necessarily give you that for now, but it's something that's being worked on at this point. We are anticipating as well that the sites, well, we did indicate last time the numbers of vaccination that we want to build up to about 250,000 during the course of per day later on the phase 2. So we do want to indicate that phase 2 is starting on the 17th as indicated, 17th of May as indicated. We also wish to indicate that anytime now we're expecting the Johnson & Johnson vaccine to land here We know they've been manufactured, they're packed and ready. They were just waiting for the final audits that were being done by Johnson & Johnson globally so that they can release our batches. Expected challenges. The point that we had to report last week was the other week was the cessation of the Sisonke trial. That study was delayed because it was discovered that there were some people who had suffered what we call vaccine-induced thrombocytopenia, which basically means that there is unexplained formation of clots or clotting disorder, which was discovered on 8 people, mainly women, in the USA, though that to halt the use of Johnson & Johnson temporarily, and we did the same in South Africa. We now are pleased to indicate that at this point we've now agreed that this should resume as of today. Our regulator, SAPRA, has looked at the matter. What we have brought in as a result of the temporary pause was that we now are issuing warnings for people to always be alert that there is a possibility of such side effects, although very rare at this point, at 1 in a million. And also the assessment that's been done globally indicates that the risk is much smaller. The risk of the vaccine causing thrombosis is much smaller than the risk of getting the infection. And with that, it's important for us to actually encourage our people to continue using the vaccine. We must also point out as well that COVID-19 does have its own impact in creating, clotting disorders, and that those are even more and probably worse than having these rare disorders reported. We have therefore asked the members now to be informed of this risk, and that they should always be conscious of it. And we've given the signs out so that people must be aware that there are certain signs, medical attention, so such as headaches, such as dizziness, such as vomiting, abdominal cramps, and any sense of discomfort that they feel. They must actually just make sure they get checked so that we can always be on the lookout for these symptoms. So, but nevertheless, we do agree that we need to continue. It's important for us because we've got 3 million coming, Johnson & Johnson vaccines coming within this month, the next 2 months, and they're going to be utilized across the country. We have also, it's also been indicated that this, what they call now VITT, which is the vaccine-induced thrombocytopenia, basically is something that has been noticed in other vaccines as well, such as AstraZeneca. And in fact, if we looked at some of the results, it does show that other vaccines as well do have this challenge. Having said so, we have also got a warning that we should not extend the vaccine, Johnson & Johnson vaccine, to pregnant women and lactating mothers. This is just a precautionary measure until we've got concrete information that comes from the scientists to say what do we need to look out for in this case. We hope that that information will come in fairly soon. On the side, I've also asked that our Ministerial Advisory Committee, together with the Society for Obstetrician and Gynecologists, as well as SAPRA, must debate the matter so that we've got a common viewpoint in terms of approaching this area. Because there's a huge debate going on among the scientists whether, in fact, this pause amongst the pregnant and lactating mothers is actually necessary. So that's an issue for scientists, and I believe that we shouldn't be alarmed about it, but what we need to do is to just get updated as soon as there's new information in that regard. Then the other issues that we have had to deal with, we published the Norfolk Compensation Fund regulations, and we're hoping that this will actually make it easier for people to understand that we are protecting them further as government so that there is no one who's exposed to a risk without any form of redress. And so this has actually allowed for all the vaccines to be able to come into the country because the Norfolk Compensation Fund set up protects everyone, particularly our own people in this regard. So that has been published from, from last week. Then we have also been following up on the issue of Sputnik and Sinovac. In particular, we have got the latest reports indicating the progress in the process of registration by SAPRA. Sinovac are at different levels. We have actually asked that the department should lay a request for an additional 10 million of these two vaccines so that we actually process the negotiations whilst the registration process is ongoing. So that again is some work that is on course at this point. So we are expecting that by the 6th, 17th of May, we should be able to resume. We need to be able to proceed with phase 2 of our vaccination. We have said that here we're looking at the senior citizens and those over 40 who have got also comorbidities, also those are the ones, but we're also targeting largely people who are in the frontline settings, those teachers, those police, those industrial workers, and those who are in community service who have got a risk of access access to so much of public that they could actually run a risk of either being infected or themselves infecting the public. So that's the whole batch we're targeting, and we've said that between May and October, that is 6 months, that's going to take us to vaccinate about 16.5 million people. We continue with that plan in place, and we have said that the numbers of vaccines, as you will see when the presentation is done, is going to slowly increase. And when it increases, it's going to get us to a point where we're able to achieve the maximal output of about 250,000 per day. That's probably likely to be reached around September. So we're going to be incrementally increasing the sites. And I must well say that we will use some of the Pfizer vaccine to study whilst we're going on with the vaccination as well. This is just to make sure that we get the same lessons on Johnson & Johnson and Pfizer. Vaccine is on course, and the 16.5 million people will actually be vulnerable groups that we have spoken about, the frontline workers, and all of these are actually part of that core. However, we would have liked to start, on the elderly over 60, and then of course when we go to the industrial setting, we'll be targeting on the prioritization helps. Was when we estimate that between now and June, we will have just over 10 million vaccines. 5.5 million people who are over 60 years could be vaccinated at that time, and we've got another extra 5 or so million people who would have been had to be vaccinated at the same time of the rest of the other workers. So if we can cooperate, we can actually do a lot to protect those who are coming at a higher risk. Now, you will also notice that in the presentation, they will show you how we're tracking the numbers in terms of the COVID-19 situation. 3 provinces that are raising concerns: Northern Cape, Northwest, and Free State. Those 3 are basically showing numbers that are increasing. However, because those numbers are still very low compared to the total number of population in South Africa, we are working on them very closely to try and reduce the further spread in these particular areas. That will be shown in the slides. And then I think it's also important to indicate as well that the work on the modeling for the 3rd wave is being done. Everything about it remains uncertain, but basically as to when it's going to arise, and how bad it's going to be, although there are indications that it's not likely to be bigger to be worse than the second wave, and that is probably likely to be a bit less. Nevertheless, what we would like is a situation where we vaccinate as many people as possible, and without being really troubled by worrying about the next wave. But we are noticing that there are a number of countries that are going through these waves. And some of the people have made comments about the concern of people coming from India. And of course, we've just been monitoring that situation. We don't yet have any indication that there's a direct risk to South Africa in this regard, but we'll continue to monitor that situation. Similar problems which we have seen in the UK, in Europe, in America. We just need to be, very, vigilant as we manage this kind of situation. There has also been reports of other variants that have come out in different parts of the continent, in particular from Tanzania. We haven't really got much of that indicated yet in this country, although we've seen that it's been spotted in other parts of the continent. We've probably got to know of it more because our scientists are working together. But as I was going through a presentation of the WHO Afro region yesterday, it became clear that the south and eastern part of our continent has got the variant, the 541 V2, which is the one that's been more dominant in South Africa. So we will continue to do genomics sequencing to check what's happening in the rest of the other provinces, so that we can be always ahead of the curve on this one. So largely, I want to make those comments, and then the presentation will come through from Director General to highlight most of these issues in more specifics, and then we can pick up the questions. Thank you very much, Honorable Chairperson. If Director General could be allowed to present. Thank you very much.
Thank you, Minister. Honorable, thank you for that opening comprehensive work. DG, you can then start.
Thank you very much, Honorable Chair, honorable members of the Portfolio Committee, my Deputy Minister and colleagues, and our colleagues from the Parliamentary Support. We will be going through the presentation. The Minister has given a high-level outline of the presentation, and we'll cover epidemiology and surveillance. We'll do a bit on the modeling work, as the Minister has touched on, and then we'll spend more time on the vaccine rollout. The data that we're presenting is the data that we had as at the 26th of April from our daily surveillance work that they're dealing with. And what's more important, we can see that our cumulative cases as at the 26th were just above 1.5 million, and our recoveries were at 95.3 as presented in the dashboard. And in terms of the cumulative deaths, we're at 54,000. And as at the 26th, the previous 24 hours, we'd seen 38 more new deaths, with the national case fatality ratio at 3.4%. And in terms of the cumulative active cases in the whole country, it's just above 20,000. And our hospitalizations, they are on the downward trend. They were at just above 3.5 thousand hospitalizations. Looking at the different provinces, on the 26th, the majority of cases were reported in Gauteng, followed by the Free State, Northern Cape, and the Northwest, then the Western Cape and Mpumalanga, with KwaZulu-Natal, Limpopo, and Eastern Cape showing a very low numbers of cases. And nationally, we've seen a 16.9% decrease in new cases compared to the previous 7 days. This, as the Minister mentioned, that the 3 provinces, Northern Cape, Northwest, and Free State, though they are showing increasing cases, the numbers are still minuscule. They don't affect the overall figures in the country in terms of the new cases that we are seeing. Then if we look at the 7-day moving average, starting from the first time we tracked it on the 12th of April 2020, we can, if we look at the two waves, the first peak is our first wave, the second peak is our second wave, which we had early December and early January this year. We can see that our infections have really moved down, and we are now actually almost plateauing at the same plateau that we were when we finished the first wave. Gauteng is still hovering a bit up, but it's something not that we are monitoring, that we're not really worried about, that it's been continuing at that trajectory. But also if we look at the first plateau, the red was still sort of hovering higher than the others because of the numbers of the population in Gauteng. Then in terms of the test performed and the positive test by province, you can see that we've got a few provinces that are showing a positive increase in terms of the positivity, and we're monitoring them. And those are the Northern Cape, as mentioned, the Free State, the Northwest, and also a bit of Limpopo. We are monitoring this on a daily basis because it's the key issues that we look at to monitor the resurgence. Then this showed again the two waves, the first and the second, the number of tests that we've been doing and the number of cases. Again, it depicts the same picture as in the previous slides in terms of the plateauing of the cases as we move into April. These are the number of tests that are being done. We're comparing the public and the private sector. The green being the public sector, the gray being the lab tests, and the dark line being the cases. Again, we see that the public sector, in most of the instances, is doing a bit of more tests as compared to the gray, which is the private sector, but they almost sometimes at par in terms of the number of tests that they are doing. We do need to, if we look at the tests that we did during the second wave, we can see that our tests are down a bit. That's what we need to be working on, because for us to pick up the resurgence, we need to have quite an increased testing campaign. And to this effect, we are pushing that we use the antigen test, especially to track our contacts so that we are able to test the people quicker and pick up if there are problems in terms of the positive and critically the contacts. Now, this graph is actually looking at the local municipalities in terms of the positivity rate. Now, the more darker the red, that means the higher the positivity rate. So if it's the dark red, that means it's more than 30% positivity. And then the light red is between 20 and 30% positivity. And we do recall that in January, when we had the second wave, we actually had positivity rate of about 31, 32, 33%. But if we look at this graph, none of the local municipalities are actually above 30%. We do have a few that are between 20 and 30%, and they are mainly in the Northern Cape, in the Free State, and also a bit in Northwest and Gauteng. But we're monitoring this, because once we start getting more red, those become our hotspots, and we need to deal with them appropriately. Metrics in the country that we use to monitor. Now, the three colors that we deal with here is a blue, which means that everything is under control. We should not be worried. Then the yellow is the alert, and then the red there is a response. Now, if it's a response, it shows that we should be responding, because that province might be moving, that district, my apologies, might be moving into resurgence. So if we look at the Free State, in the Northern Cape, we can see that the main district that has been problematic has been the Namakwa district. That's where we picked up clusters of infections, which were investigated mainly in the schools and in the mines, that we had to work very hard to deal with them. And we can see that the red there has been a bit consistent, and it's still on the red part as we are in April. So we are monitoring that, as the minister did mention. Even though the numbers are small, but they are on the high side if you look at their population. Similarly, Francis Bart as well, and JTG, which is John Taulo Gaisitsiwe, and then same with Zetsefumtau and Pixligasem. But with our major worry is with Namakwa and a bit of Francisburg. But we're dealing with those cases with the province so that we are able to deal with those clusters. Because if we don't deal with them, they might actually lead to a resurgence as we move forward. But also what we also want to show here, if we look at Namakwa district, if we look at January where we had the second wave, they actually never went out of the second wave. They've always been red. And then when those clusters came, then they peaked again. So they never went out because if you look at the others, for example, JTG, in some instances, they did go into yellow, which is the alert, and they also did go to blue. But this one has been quite problematic, Namakwa. Also, we are monitoring Pixligasem as well, which is your DR area, and just noting that it's also on the peak. And then Zetsefumtau, it was on the yellow, which was the alert, and then it went back to red. So we're monitoring that in the province through our researchers metrics. If we come to the Free State, in the Free State, the main problematic district that we've been dealing with, where we've had to deal with clusters in schools. Is Thabo Mofokeng, and we're monitoring that, and we've actually strengthened our case management there, the contact tracing, and our teams are working daily just to ensure that we deal with those areas. Similarly, Mangaung, it did go into yellow, but it's now back into red, so we are monitoring it again there. They had some family clusters, and we've had some transported cases from Northern Cape in Mangaung, where we had some families that had visitors from the Northern Cape. But we've done a full analysis, and our teams are on top of that. And we've got a bit of a peak in Leisure Putsa, which is your Welcome area, which the teams are dealing with them. Then when we move to the Northwest, we're not worried much about Bojanala, which is the Rustenburg area. It's on blue, it's on control. And Dr. Kenneth Kaunda, we're starting to see that it has moved from alert to red, which is action. And here, most likely because of its proximity to the Free State, there might be some imported cases, but the teams are also working very hard and are on top of issues in that area. Dr. Ruth Sehomotsi Mompati, it's now on alert. It's been on blue, which was control. And then when we go to Ngaka Modiri, it's been on alert, but we're starting to see a bit of the red. But our teams are daily monitoring this, and this dashboard is actually updated at least thrice a week to ensure that we don't miss anything in terms of our research and metrics. So really, in terms of the key indicators, nationally, we've seen a 16.9% decline in the reporting 7 days at the 26 as compared to the previous 7 days. And then we've also seen a 3% decline in the positivity rate in the reporting 7 days compared to 7 days prior. As mentioned, when we reported the 26th, Gauteng had the majority of cases, Free State, Northern Cape, Northwest, Western Cape, and Mpumalanga following. And then KZN, Limpopo, Eastern Cape, they really had very low new cases on the 26th. And 5 provinces that showed positive percentage changes in the 7 reporting days is the Free State, it's Gauteng, it's Limpopo, it's Northwest, it's Northern Cape. And then the highest number of new cases per 100,000 population were reported in the Northern Cape, followed by the Free State and Northwest. And this is in keeping with the open remarks of our minister. And we are monitoring these provinces quite closely, also including Gauteng as well. And Northern Cape has the highest number of active cases per 100,000 at 256.3, followed by the Free State and the Northwest. Again, it's the same provinces that we were trying to monitor to ensure that we deal with the issues. In terms of hospitalizations, we had nationally a decline of 12.7 in the 7 days compared to the prior reporting 7 days, with a slightly increase in the following provinces: Eastern Cape, Free State, Limpopo, Mpumalanga, Northern Cape, and Northwest. And then the upward trajectories in hospitalizations, positivity rate and new cases were observed in the Free State, Mpumalanga, Northwest, and Northern Cape, and these are being monitored closely. The Free State currently reports the highest number of hospitalized patients per 100,000 population, and it's mainly in Thabo Mofokeng district. It's followed by Western Cape, Northern Cape, Northwest, Gauteng, KwaZulu-Natal, and Mpumalanga. And this is per 100,000 population to ensure that we compare apples with apples. In terms of the deaths, we've seen an increase of 8.9% in the reported mortality in the reporting 7 days compared to the previous 7 days. And on the 26th, we reported 38 deaths with 5 Eastern Cape, Free State, Gauteng, and none in the Northwest, none in Mpumalanga, 2 in Northern Cape and Western Cape, 17, bringing the cumulative number of deaths to 54,186 deaths in South Africa. A bit on the modeling consortium, as our minister was doing his opening remarks, our modeling team that's comprised of the team from, it's a number of different teams that work together, and they all form what we call the South African COVID-19 Modeling Consortium. And they are working on this one. I think one of the issues that they are looking at is the R number, which is the number of people that each index case infects. This is very important as it is a very sensitive indicator. And we can see that it is slightly increasing since February, but in all provinces, the R number is similar to the national trends. It's close to 1 in all provinces. And it does imply a potential for resurgence, especially if the contact rates increase. But our teams from the modeling consortium are monitoring this number. What are the potential drivers of a third wave? 1, behavior change in terms of reduced adherence to non-pharmaceutical interventions and public health measures, easing of restrictions, holiday travel, super spreading events. The second one, which is much more worrisome, is the possibility of the viral mutation and getting the new variant coming in, seasonal factors, and also waning of immunity produced by the previous infections. As the minister mentioned, there's really uncertainty in terms of when the third wave might come, because there are many factors that are going to contribute to that. But what's more important is that we need to focus on behavior change to ensure that we are able to monitor, but also we also working closely with our genome sequencing team, as the minister mentioned. For example, when we had those clusters in the Northern Cape, we made sure that they are able to get those specimens and ensure that it's still the 2 variants that are still predominantly circulating in South Africa. The B1351 is the variant that was responsible for driving the first wave, and the 501YV2 variant is the one that was driving the second wave. And we're just monitoring that the other variants that have been discovered in other countries, they don't come up. Hence, we are really on alert, and our genome sequencing team is actually ensuring that we pick this up as soon as possible. Then, as mentioned, the timing is uncertain. We can't really say when will the new variant emerge. This is unpredictable. The NPI fatigue may develop at a slow or fast rate. It's very important that now and again we communicate to ensure that people don't get the NPI fatigue. Of course, seasonality is projected to have a small impact. So it's important for us that then through the team again, we are monitoring the movement of the people through Vodacom and Google databases to know in terms of movement of the population, as especially there are some areas as we've picked up that have clusters, and as they move to the other areas, we should be able to pick up in terms of the spread of the infection. And the size of the third wave will really depend on the rate at which the contacts increase, but also looking at what protective measures and what fatigue is there in the different areas. So for us, the scenario is comparable for the estimated response in the second wave. It would be unreasonable to assume there's fatigue in the third wave. So we need to continue working on these areas to ensure continuous communication. The impact of vaccinations. Vaccines are not modeled in the third wave scenarios, as the impact depends on the timing of the third wave and on the vaccine rollout. And we believe that in the absence of the new variant, and if NPI fatigue is delayed, we should get our infections to zero, and this should afford us more time to vaccinate as many people as possible before the third wave, as our minister mentioned. Key messages that comes out from our modeling team is that in the absence of the new variant, we expect the peak of the third wave to be lower than the second wave. The time from initial increase in transmission to the peak is on average 2 to 3 months. And in all age groups, the hospital admissions are projected to be lower than in the second wave, where we had quite a higher admissions in the second wave. And then the admissions at provincial levels are dependent on the seroprevalence after the second wave, and also age distribution and the prevalence of comorbidities. Seroprevalence is highly uncertain in some provinces. We know that some provinces like the Western Cape, Gauteng, some a bit in the Eastern Cape, they've done some work through National Blood Transfusion Services, but also they've done some testing of the blood of people who've come to their regular clinics, the child health clinics, the NC clinics, to see the prevalence of antibodies within those people. But that data is not available for all the provinces. So we can't say for a fact in this province, this is a seroprevalence, except in those provinces that have done the work. So we are monitoring the trends because this would be the best estimator for us on when the third wave is likely to begin. And the emergence of a highly transmissible new variant may result in the third wave of the same size or worse if it is more severe or provides opportunity for immune escape. That's why it's important that the testing and lineage classification is ongoing by our genomic sequencing team. The delaying the start of the third wave will allow us more time to vaccinate people. Honorable Chair, I will move on to update on the vaccine rollout. As the Minister has covered most of the areas here, I'm not going to spend much time. As the Minister has mentioned, the Sisonke is resuming today, following work that was done by Ministerial Advisory Committee, our regulator, SAPRA, and the relevant ethical committees. And we hope to finish within the next week or two in terms of the remaining 200,000 doses that we got as part of the research stock. The Minister has spoken. The Norfolk Compensation regulations were published for comments and they were gazetted on the 22nd April. We're currently working on the directions to effect the regulations. And by publishing the regulations, we're able to meet the conditions precedent to the delivery of the vaccines. The Minister has touched on the update on the Sputnik and Sinovac vaccines. SAPRA is reviewing the data. We had a call with them even this morning. And in addition, meetings have been held between both the manufacturers and the Ministerial Advisory Committee on these vaccines. SAPRA has confirmed that communication to both local applicants for the vaccines will be sent this week, and they will also be having a meeting this week, and they are fast-tracking the review of these vaccines. In the interim, we are starting to negotiate the procurement of 10 million doses from the two manufacturers pending SAPRA approval. On the vaccine supply pipeline, these are the doses that we have in terms of what is in the pipeline, both from Pfizer directly, but also for Pfizer through the COVAX facility, and the doses that we're going to get per quarter. But in terms of the delivery schedule, as mentioned, the J&J is still expected this week. As the Minister mentioned, they're still doing some global auditing. The vaccine is packed. So there is a meeting that started at 9 o'clock between our team and J&J. We hope to have an update after the head portfolio committee. And Pfizer has provided us with their weekly supply schedules, which allows us to plan properly in terms of allocation of the vaccines. Then, as the Minister has mentioned, we've got the sites that have been on the spreadsheet that have been identified, and they are being curated, and they will be implemented in an incremental manner. As we move on, lots of work has been done between the public and the private sector. Of course, the South African Pharmacy Council, as they are responsible for the curation of the sites, working together with us on the Section 22A of the Medicines Act to actually ensure that the sites are compliant. These are the, for phase 1B, these are the allocations that we've put in to finish off the healthcare workers. And then we're working on the allocations for phase 2, as the Minister mentioned, between the heads of departments. And we meet twice a week with the private sector to ensure that we are aligned in terms of the allocations. in terms of the EVDS registration, as at yesterday, 27th of April, by 14 hours, we had a total of 1.338 people registered on the system, of which 804 were healthcare workers for phase 1. And then we had an additional 533,000 for phase 2, which we are trying to ramp up. We are in discussions on how we communicate to get people to register. We know that the pausing of the Sisonke trial, the J&J Sisonke trial, might have made some people hesitant. And we believe that now with the J&J continuing, having resumed with the work, we are going to increase the appetite of the people, especially the over 60, to start with the registration as we move forward. Again, this is the same, but we're focusing on the healthcare workers and then in the different provinces. And then these are the additional numbers that we picked up on the system yesterday in terms of the provinces. Now, these are the not phase 1, but the elderly and the others that have started reporting. And we can see that most provinces are actually doing well, but Gauteng seems to be having quite more numbers, Western Cape as well. So we do need to work very hard, especially to assist our elderly in the rural areas, which the provinces are actually doing that. So we'll be following up with them this week. That would be our submission, Honorable Chair. I will hand back to my minister. Thank you very much.
Okay. No, thank you very much. Before the minister comes again, let us maybe raise the questions that have been raised by honorable members. I will have to give the members their numbers. Number 1 would be Honorable Van Staden. Number 2 would be Honorable Munyai. But I see that Honorable Munyai has since indicated he'll come to that when I see him deleting his name again. Number 3, Honorable Wilson. Number 4, Honorable Dr. Tembekwayo. Number 5, Honorable Gela. Number 6, Honorable Dr. Jacobs. But before Honorable Van Staden starts, I promise to read the questions of the 2 honorable members who are not able to be with us because of travel. For the Honorable Imam Sheikh, and also Honorable Ismail is challenged by the in connection. I'll read it as is. There's already a follow-up.
Sorry, Chair, I'm available for the next few minutes. If you have the opportunity, I can pose my questions.
Yeah, please do that, and also raise that follow-up, because the minister did touch on the issue of travel from India, but then you also wrote a follow-up. Do touch on that, Honorable Minister. Let me allow that. Yeah, okay.
Thank you, Chair. Minister, you know that we have a crisis in the country, and we know when COVID-19 first started, even the healthcare sector in South Africa was so badly impacted. Now the question is, why do you want to wait before another crisis unfolds in the country and then put restrictions on travelers that are traveling from India into South Africa? You know, India's got a crisis. 52 passengers traveling from Delhi to Hong Kong who tested negative in their country, tested positive on arrival in Hong Kong. Now, why do you need to wait and not put South Africans first by putting some restrictions on travel from India into South Africa right now? That's the first question. The second question is, why don't we roll out this vaccine to all private sector as well, including pharmacies, medical practitioners and things like that, so that we could roll it out with a matter of urgency given the crisis that we are sitting in the country? The third thing is, can you confirm, Minister, has there been any serious side effects or any deaths reported, or to your knowledge, or to the knowledge of SAPRA or the National Department of Health, on people that have been affected by the rollout of Johnson & Johnson? Now, I know you're saying that you are going to put some restriction. Roshni in Vereeniging has an increase in infection as a result of the returning nationals, foreign nationals from India. Are you aware of that? So could you please guide us as to what we're going to do? We don't want a crisis in South Africa, or South Africans are now going to be infected, and your department is not going to be in a position to be able to deal with the crisis. So can we act appropriately and timely, Minister? Thank you.
Honorable Ismail, Honorable Imam Sheikh, how much time do you have before you board the plane? Imam, Honorable Sheikh, how much time do you have before you board the plane? Okay. I was
Chair,
going
I'm
to
boarding
request
right
that
now,
the
Chair.
questions are for us. So the minister may not have to answer now, eh?
No, not necessarily, because I am boarding right now, Chair. Thank you.
Okay, good
Thank you,
luck.
Chair.
Thank you. All right. Yeah, no.
Thank you, Chairperson.
Before, Honorable Munyai, you are number 4. After I've read Honorable Ismail's questions, you come after Honorable Van Staden. Let me then read the question of Honorable Ismail. She says, Honorable Minister, what programs or methods are being put in place to assist the elderly in registration? Many do not know how to use laptops, and registering on a cell phone is very difficult. Next one, what budget has been put aside for the installation of devices at sites to assist with registering the elderly? The last, which is number 3, will there be home calls for elderly registration, or do they need to physically do it at a clinic? This will be a COVID risk, and it is also a challenge for them to physically go there to register. Honorable Minister, I will post these questions to Mr. Joe Khatla so that you can also pick them up on your responses. Now we start with our list. Number 1 is Honorable Van Staden. Number 2, Honorable Munyai. Number 3, Honorable Wilson. Number 4, Honorable Dr. Tembekwayo. Number 5, Honorable Gela. And number 6, Honorable Dr. Jacobs. In that order, Honorable Members. Thanks.
Thank you, Honorable Chairperson. I have a lot of issues we have to touch on today, so please bear with me for a few minutes. Honorable Minister, regarding the compensation fund that was gazetted last Thursday, the 22nd of April, my question is, why was the public only given 4 days to comment and give inputs on these regulations? I have sent an urgent letter for your attention to bring it under your attention that the process of public participation must be extended to at least 30 days, so as to afford the public and affected organizations a fair chance to comment on this compensation fund. I have only received a letter of acknowledgement. I just want to know why was there so much haste to establish this fund? My third question is, taxpayers will be responsible for amassing the 250 million rand needed for the compensation fund. Don't you think that they have a right to provide input on how the fund will be spent? And further information on the fund is very unclear. For example, how many people will serve on the funds panel that will consider the relevant claims and appeals, and who those people will be must be announced. Can you give us more clarity on this, please? Then have you and your department actually forgot to establish such a fund? Because why I'm asking this, you know very well from the very beginning that South Africa is a too much rich country to qualify for the World Health Organization COVAX compensation fund. Why was the regulations for this fund not published in January 2021 to give enough time for public comments and inputs? Now, as we all know, the Sesonke program is continuing today to complete the vaccination of healthcare workers, that now stands at the tally of 292,000. What is the department's new target to vaccinate the total of 1.5 million healthcare workers? And will phase 2 start even if phase 1 is not fully completed, or will phase 1 first be fully completed before phase 2 starts? And will the 292,000 healthcare workers that was vaccinated with the Johnson & Johnson be monitored for any side effects, just to make sure but they will be okay, and how will they be monitored? And healthcare workers that is still not vaccinated must now give permission to be vaccinated. Will these permissions be in writing, or how will the department handle these matters? I think we just need some clarity around this matter as well. Now, you've mentioned this morning about the woman who is currently breastfeeding and pregnant, but must not take part in the vaccination program, as SAPRA has announced. I know you have touched on that, but you have break up a little while we were talking this morning. That's what I'm asking. Can you give us the reasons for this announcement? And if I have to play some devil advocate, are you suspecting something for SAPRA to make such an announcement last week? Now, Honourable Minister, we saw the past few days that the public healthcare system in India had now totally collapsed under the pressure of COVID-19. My question is, if South Africa must reach an infection rate of over 300,000 positive cases overnight, will our public healthcare system be able to hold up under such enormous pressure? And if yes, can you wait your answer, please? I just have two more questions, Chair. The Livingston Hospital and PE's operating budget has been cut by more than 100 million rand. And I think this is also being reported in the news this past weekend. Now, basic services such as clean linen and food for patients cannot be provided at this hospital. And medical claims against the Eastern Cape Health Department amount to an amount of 36.75 billion rand. Are you worried about this? And what precautions do you have in place to prevent and eradicate problems like these? And what is your prediction on when will South Africa be entering a third wave? And will it be more severe than the others? And my last question is, will the total number of 3,357 vaccination facilities across the country be enough to administer the vaccines? And are they duly prepared to do these vaccinations? And when will we, as members of Parliament and the VIS Portfolio Committee, receive a final list of vaccinations facilities? It's a mouthful, Chairperson. Thank you very much.
Thank you, Honorable Chairperson, Dr. Zomo. First and foremost, I think it's important to really appreciate a platform in which the Minister will come and really update us on a regular basis. I will appreciate if this opportunity could be sustained, because we get updated on real-time issues and so on. So that's very important. We welcome the briefing by the Minister, or the update by the Minister in this regard. And I think it's very helpful, because at some point, some provinces who in their opinion seeks to be federal in a unitary government, they did not have confidence that vaccine is going to come in the areas such as Western Cape and other areas. So we need to encourage you, Minister, to continue to work very hard and update. It's very necessary. And after your presentation, I thought I raised my hand prematurely, thinking that after your presentation, I'll raise some question. After receiving the presentation by the DG and also the Minister, allow me, Chairperson, really not to ask any further question, because the update was so fundamental necessity and providing clarity to the doubting Thomas of the capacity of the ministry to provide the needs and vaccine needs for the people of South Africa. Thank you.
Thank you, Chairperson. Chairperson, yeah, I think a couple of people have covered some of the issues that I would have liked to have discussed and got responses to. So I will keep mine short. First of all, can the Minister or the DG please tell us how many private applications have been done for the private purchase of vaccines? This has been allowed, and we need to know if any applications have been made, and what the situation with regards to that, or the regulations are with regards to that. Number two, Minister, apart from the very slow and very stagnated rollout of vaccines, we have phase 1, phase 2, phase 3, and we're still trying to get the health workers done. We're then going into the 60s, 60-year-olds. However, Minister, we are getting calls, and I've asked this question several times and I'm not getting a response. There are people from South Africa who are employed overseas, who have acceptance to universities overseas, who have contracts overseas. These are predominantly young people who are unable to find work in this country, who have been given contracts and work overseas, plus people who have not been able to return to their countries of work as a result of the COVID lockdowns over the last year. Now, a lot of those people cannot return to their places of work or to their studies because they need to be vaccinated in advance. And this is concerning. We cannot employ those people in this country. Our employment rates and opportunities here are about zero for young people. Those people who have employment overseas need to get back there. This is all money, foreign currency that comes back into South Africa. Is there no way that a provision can be made for somebody who can produce a contract or an acceptance into a university to have them included in this vaccine rollout sooner rather than later, so that we do not have any more lost opportunities because the South African economy just cannot support them. We have queries about this over the entire country across the board. To the DG, you had a slide testing positive by health sub-district. This is where you discussed the dark reds. And on that slide, DG, there is areas of white where it says, and on your slide, it actually says no data. It's very concerning to see how many sub-districts on that slide are actually white. In other words, we have no data from them. Now, I find that a bit upsetting and a bit alarming. Why are we not getting any data from any sub-districts? Is it because there is nothing there, or because we're just not getting data from them because they're not efficient or behaving in an effective manner? I'd like clarification on that, please. Minister, and the Honorable Sheikh Imam has raised this, and our hearts go out to the people of India. They are really, really being hit hard by COVID. The situation there is dire, and our condolences and prayers go out to the poor people who lost their lives in that dreadful explosion in the hospital. But the fact still remains, and while our hearts and prayers are with those people, they do need, there's a lot of them that will be coming to South Africa potentially. What plans are we putting in place to ensure that the Indian crisis is not brought to South Africa? DG, you talked about SAPRA and the review of Sputnik and Sinovac. We have seen this on reports over several weeks now. How long does a review take? Is this an indefinite thing? Is there a timeline? Is there a time and a place where we can expect response on this? I think constantly hearing it's under review, it's under review, it's under review is frustrating, particularly as a time when we have very, very slow vaccine rollouts and insufficient vaccines in this country to create a national immunity. And you talk about 10 million doses there. Those 10 million doses are critical. You are aiming to order them, but are held up by a review. Can you give us some clarity on this? That's it for me for the moment, Chair.
Thank you, Chairperson. Let me also start by passing a word of condolence to the families and friends of Jacqueline Mofokeng and daughter. May their souls rest in perfect peace. I just would like to start by saying the issue of India and the vaccination phases that I could have asked about has been exhausted, so I'm not going to mention any information about that. My question one would be, how are the medical schemes and healthcare providers going to make financial provisions for this continuing rollout of the vaccines? Number two, how do you define the price to recover the vaccine and associated logistic costs from the medical schemes? The third one, how will the private healthcare providers, such as pharmacies, be compensated for dispensing vaccines to state patients? And the following one, what is your level of readiness for, say, for an example, that there should be an unexpected abrupt third wave occurrence? Because at this present moment, you have procured J&J and Pfizer, and we are not even sure whether they can be able to be used against the occurrence of the third wave. Yes, we have heard that from the presentation that there is progress made towards the Sputnik. But my question is, there are people who definitely, who are South Africans, who would prefer to receive Sputnik as their alternate vaccine, because of its safety and effectiveness, as it has been proved through those studies concerned, specifically because according to the results thereof, there is no serious adverse events that were detected. Most adverse effects were mild, except experiencing pain at the injection site, as opposed to clot and death J&J vaccines. So we just would like to know how speedily can the Sputnik be procured so that people can exercise the choice of their preferred vaccines. And Minister, I just would like to state this because every time in this type of meeting, I am asking questions that have got nothing to do with the vaccine update, only because of one reason, to say when I ask questions to your committee, no one comes back to me except in a sitting like this. And I find it to be very much unfair and it's unacceptable, because I've been given people to say, if you have problems, give us these problems, but they don't come back to me in time about the problem that I'm asked. And I'm very sorry, I'm still going to ask the very same question that has not been answered about the internships in Gauteng province who are not receiving stipend. In 2 days will be in May, which means they are already in their 5th month working there as interns, but they don't get the stipends as compared to all other provinces in the country that are getting stipends. So please, next time when I ask questions, let them be responded to outside this committee. Thank you. Thank you, Chair.
Thank you very much, Chairperson. Let me also welcome the presentation and also the briefing by our Minister. Chairperson, I'm very happy about the slide that talks about the Sputnik and Sinovac vaccine that was done by our DG. I'm very happy about that there is a progress, and also there will be engagement, and we are looking forward to get update on that one. But coming to one issue that I want to ask Minister, I want to check whether there's a need for the provinces to buy their own vaccine as provinces or what, if I can just get the clarity on that one. But so far, I'm very happy about the progress and also the update that you keep on giving us as portfolio committee members, so that at least we understand and we know exactly what is happening around the vaccination. That will be my take, Chairperson. Thank you very much, Minister, for your commitment with your team and the work that you are doing so far. we are very happy as a country and also as a portfolio committee in terms of the work that we are doing. Thank you very much.
Thank you very much, Minister and DG, for your presentation. We appreciate it at this time. We also know the progress that was made to restart the vaccine rollout today. We commend the department for that, and we are very thankful that this process will be starting again. Now, there is a general concern with the pace of vaccine rollout in South Africa, especially considering that we have 880 new cases in the past 24 hours, that there is increased hospitalization in certain provinces, although there is a national decrease of 12.7%. That people generally have a concern with a third wave coming sooner than expected, and that we note that there are no new variants in South Africa, but as you correctly state in your slide, DG, that variants may emerge at any time. So my question on this part is, what is the current thinking on contingency plans should the third wave arrive sooner in South Africa than what is anticipated? And then in terms of the preparations for that potential third wave, I want to ask a number of questions. What is your hospital and other facility readiness for this? What are the treatment regimes in place, and are they being kept as they were before? And is there continued work in order to improve on the treatment regimes? What is the oxygen availability now in South Africa? We see this in India being a major challenge, and are we still working on improving this? And what is the EMS preparedness? And then lastly, in terms of temporary facilities, I hope that they are being retained and they kept at a readiness for a potential third wave, and that we are not actually closing those. Thank you very much. Have we lost you, Honorable Dlomo? Have we lost you, Honorable Dlomo?
Yeah, it seems we have lost him. It seems we have lost him because I also cannot hear him.
Minister, I will not ask questions now that my line is still unstable. Maybe you can just start answering questions. I will probably talk later after, just to summarize some of the things that I've seen that have come up from a very important presentation. But my question was, let me just try now. It's just still well. It would also to amplify the question asked by Honorable Ismail. What are the necessary steps that we are putting in place to assist the elderly, especially in the rural areas, with registration? Because the numbers that are coming up are okay, but they're still small. I think your input was very helpful to us, that you are now restarting today, because the risk of the thrombosis with the vaccine is far, far, far less than the risk of a COVID-19 infection. And you will be monitoring, and there's a specific group of South Africans and women who are pregnant and lactating. We really agree, we accept that, and that is very helpful. That the J&J, the agreement has been signed and is already moving on. The Pfizer also is on track. Maybe the minister will indicate that the pressures that we put on him by disclosing some of the things he did last time have actually helped him to accelerate finalizing the negotiations with Pfizer and the rest of the other, with the J&J, Pfizer and the others. But also I want to commend you for continuously getting into Sinopharm and Sputnik, because those are your friendly forces in the world, and therefore we should be seen to be also supporting them. But we note that you are saying the matter is still with the SAPRA to finalize. Minister and your team, then you can maybe start responding. Thank you very much.
Thank you very much, Honorable Chairperson. May I ask that the DG starts, particularly to deal with the questions of the readiness in the hospitals, and also to deal with the other issues which have been raised. I'll come in after the Director General. Thank you very much. DG, if you could start.
Thank you very much, Honorable Minister. Thank you very much, Chair. And thanks to the honorable members for the questions. I will pick up the easy ones and leave the difficult ones for my boss. Firstly, starting with Honorable Imam Sheikh, I won't touch on the India travel, I'll leave it for the minister, but rolling out to the private sector, our sites, they do have sites from the private sector, both in the form of pharmacies and also in the form of the private practitioners. Again, this is work in program. We're doing the curation with the Pharmacy Council. So there's quite a number of private sector sites that are there. In terms of serious side events or deaths that are linked to the J&J, we have not received any. SAPRA reviewed the data and the reports, and so far now we don't have any of those serious side effects or deaths related to the administration of the vaccine. Then the issue that was raised by Honorable Ismail and also raised by the chair, the program or methods to assist the elderly. Yes, we are working with the provinces. We do agree in the rural areas that we need to have special programs for registering the elderly. Let me start by saying that no one will be turned away on the site if they have not registered with the EVDS. There will be the kiosk for registration on the sites. However, to fast track the process, the provinces, in our meeting with the HODs, they are actually using the community health workers. We do have some gadgets available in the provinces in the form of the tablets and the cell phones for them to go to the households and register the elderly beforehand. But we are also trying to promote that in the family, if there are younger people who can assist to register the elderly, they are able to do that. But nevertheless, if that doesn't happen, when they get to the site, they will be able to be assisted and be vaccinated, and they will be sorted out accordingly. And then on the issue of the NFC, I won't touch much on that. The minister will deal with that for us. But the other questions that came from Honorable Van Staden was the new target for healthcare workers. Yes, we know that with the Sisonke, we're going to be doing about 500,000 healthcare workers because of the doses that were available. And then we've already done the allocation to do the mop-up of all the healthcare workers. And those are the doses for what we call the phase 1B that were presented today to ensure that we clear up to the 1.2 million that was initially raised as a target. In terms of the vaccinated workers follow-up, yes, there is a protocol. They are being followed up, and they are able to call a number if they have issues. This is part of the protocol as approved by SAPRA on the study, so that they are able to report if there are problems that they are actually picking up as they move forward. On the issue of, again, the issue of India, I will leave that to the minister to deal with. And in the issue of lactating women, the minister did actually raise this appropriately, that our scientists, in terms of the Ministerial Advisory Committee, the South African Society of Obstetricians and Gynecology, they are actually working together. Actually, I did have communication with the chairs last night to send them that we really need to get a proper guidance on the matter of lactating and pregnant women, so that we are able to communicate this accordingly as we move on. On the issue of Livingston hospital budget, I would like to reach out to the Eastern Cape and get more detail, but the CFO is on the call. Our CFO, so if he needs to comment on this one, he can guide us if there's information, but otherwise we can prepare a response onto that one. Similarly, on the issue of the medical claims, the issue of medical claims is a problem not only in the Eastern Cape, in the whole country, and we are working out mechanisms on how to deal with medical litigation in general to be able to deal with it. Actually, we are looking at the future on how we can actually, just like the other countries, start to develop a compensation system that will be able to help us to deal with medical negligence claims as we move forward. And then there was a question from Honorable Wilson about private application for the purchase of vaccines. I might be talking in parallel here, but my understanding is that currently we are procuring the vaccines for the whole country as government, and then the private sector is actually procuring from us. And then at that level, probably I need to cover what Honorable Thembekwayo did put. We are working on a mechanism that we're waiting for our minister to approve on how we're going to get the reimbursement for the vaccine, which will cover the actual cost of the vaccine, the logistics of the vaccine, and the other areas that we need to cover. So our price will be an all-inclusive price that covers all the costs that are associated with the vaccine administration. And then on the issue of the Sputnik, how long does the review take? I must say it also depends on the provision of the relevant information from the applicant. And we know that both the two vaccine manufacturers have appointed the local representatives, because it can only be the local representatives that can lodge an application for review with a SAPRA. So if all the information is available that is needed for the review, it becomes quicker. But if there's some more information that still needs to come in that they need to get, and more importantly for us here in the country with the lineages that we have in terms of the 501 YV2, that some testing needs to be done to ensure that any vaccine is going to be efficacious against that variant. They need more data, and sometimes the swapping of specimens. So that's what delays the issue. So it depends on the readily available data and any further data that gets needed. However, the regulator is actually trying to fast track this for us, and they are saying that they are actually sending even some communication out today to get extra data so that they can move. So it's difficult to put the time on how long does the review take. And then in terms of the level of readiness, I think as a country, through our IMT, we meet quite often, and we follow up on what is available in terms of, we've got actually a stream that we call hospital readiness stream that looks at the facilities, availability of beds, ventilators. Actually, we have so many ventilators in South Africa through the National Ventilator Project, through CSIR, and then the availability of oxygen, where we've got a team that works directly with our suppliers of oxygen, and we feel we are ready. Anytime there's a problem, we'll be able to deal with it as we move on. That's why, even though we've got less admissions now, but we always ensure that we are on par with that, and we have everything available should we start getting increased admissions. Then when it comes to the availability of the beds outside of the hospitals, some of the field hospitals were decommissioned, but it takes a very quick turnaround time to recommission them. For example, in KZN, during the second wave, they had decommissioned some of the field hospitals, and when we needed to recommission them, it took literally almost less than 10 days for them to have the hospitals up and running. So we are really ready on that side to ensure that we are ready with the beds in readiness for the third wave. And then I'm not sure if I have missed anything, but I've got my colleagues, Dr. Tulare, if they want to come in before the minister, if I've missed anything from my list. Thank you very much, Minister.
No, thanks. Let me come in at this point, and that's outstanding. the chair will guide. But I think that you have covered some of the issues. And let me quickly go through some of the ones that I think also may need to be emphasized. Firstly, the concern about what's going on in India, I think is understandable. India is going through a huge wave, and the numbers of people who are getting infected per day is huge, and those who die, I've even begun to see people who are panicking, saying that maybe that number is underestimated. I think I understand the panic. All of us would be concerned that such a situation should not come to our country. And I would want to align with those, excuse me, who are expressing sympathy and support to India and condolences on the wave. And we understand that this can affect any country as such. However, we do not have a direct flight from India. And I think members should be aware of that. I've been seeing a lot of stuff circulating in the WhatsApp groups. The government is not aware, and so on. The flights are not being monitored and so on. We don't have a flight from India right now. There are no direct flights. We are demanding PCR tests for people who are coming through. And so we will be checking if people are coming in from any other parts of the world with any positive reports. We would also, I've asked my team to look at ways of how they can track if there's anyone who could have come from India, just to check that everything is fine and that there's anything we need to worry about. I want to just assure you that we are aware of that situation, but I think we must be aware there's no direct flight from India that would suddenly offload so many people as such. The problem of all these restrictions from countries is that people can go via other parts of the world, and by the time they get here, they won't really be showing anything direct from India. So that's an issue that we must just keep in mind. Then the question by Imam Sheikh, Honorable Sheikh Imam, was why not roll out to the pharmacists and GPs? We actually are rolling out to the pharmacists and GPs. If the members are not aware, please be aware. We are doing that. We won't roll out to all pharmacists, we won't roll out to all the GPs, but to some. It's the logistical issues that are going to be involved here. And so I have asked that they must show the honorable members some of the list so that we can go through the spreadsheet. It's quite an elaborate spreadsheet that has got too many names as such. And that's why at this point I said we don't want it to be published, because there's still a lot of cleaning up that is going on there. But because the members kind of feel as though there is no list, we give you the list, but we're saying, allow us to finish the work. And that's the point. So you have also heard from from the Director General that there are no serious side effects on the Johnson & Johnson vaccine so far in South Africa. And please believe us, we don't have those. We are watching out for some of the side effects that have been reported in other parts of the world, but we don't have them as such. Then Honorable Imam Sheikh was saying that there's an area of Roshni where there's been a huge increase in the numbers of people who are positive. They came from India. We don't have that information. So if Honorable Member could share that with us, we could do so. We are monitoring different parts of the Free State, and in this case, we have shown the report. We can break it down to you further than what was presented by DG. We are following up and we are monitoring. And at the moment, we have not got a report suggesting that this is due to India. We are actually seeing this in different parts of the Free State. And so that's why we've reported the matters. But also in relation to the variants, we are involved in continuous genomic sequencing. And so we will pick it up if we think that there's something that would have come from India as such. The Honorable Ismail asking how we're assisting the elderly. Basically, the registration portal will help those who can register and then those who can be assisted. We have said that community health workers will be assigned to go out and help to register some of the elderly and the citizens in general. However, when it's time for vaccination, the registration in the portal won't be a prerequisite. You need to come in on the basis that it's your turn, based on the category that's being vaccinated. And on that basis, we will then register people as they present themselves. So people should not fear that if we don't see many people registered, that means they won't be vaccinated. The electronic vaccination data system is to record who has been vaccinated, which means if you are not registered before you came, then you will be vaccinated, you'll be registered exposure. But if the risk of exposure to COVID is basically linked to the fact that you'll get a vaccine, I think that distancing and use of masks and sanitizers for that particular day when you're going through vaccination is a worthwhile risk. And then, of course, in about 14 days after vaccination, you should begin to develop antibodies. So I think we mustn't be frightened again to go to the vaccination site because there are more people. There may not be a situation where we can get a doctor or a nurse that will go into every house and vaccinate. We don't have that as an arrangement because of the population size that we're dealing with. So we will be only calling people to a vaccination site, and therefore we would try and protect them as much as possible as they come onto that site. Honorable Van Staden, well, asking why didn't we publish this in January about the Norfolk Compensation Fund? Well, the reason is that we were going through discussions and consultations. It has taken a lot of time and discussions and a lot of ideas to put together these regulations. We were to go through quite a lot of that within different departments, getting approvals amongst ourselves, negotiating what this would come to and all of that. So in January, we're not ready. There was not enough information about it in the first instance. And although this matter had been discussed, the timing of it had not at that point been possible to, immediately publish some of those regulations. Now we gave 4 days, 5 days a notice for publication for comments, mainly because we needed to confirm to the manufacturers that when we start, we will be able to get the vaccinees protected. We had an agreement between them that up until the 30th of April, we would have the publication of the Norfolk Compensation Fund, and that fund would be set up and publicly announced before the 30th. So that was on our agreement. So we didn't feel that we need to wait until the last day, because if we waited for the last day, the manufacturers would wait until that last day before they can start preparing to release the vaccines, just to make sure that everything is properly aligned. So that was the issue. If there are people who might still be wishing to make comments, they're welcome to make comments. We'll look at them and consider them, but obviously it will be a matter of whether they would have an impact in changing any of the things that have been already published. I must say, though, that we really thank all the South Africans who have commented, because we reported last week we had over 13,000 responses. So even though it was 4 days, but that didn't stop South Africans from commenting. If we didn't get any comment, I would have been worried that people thought that was too short a time, but it didn't stop 13,000 comments. So I think we mustn't feel so frustrated about the 4 days, because people did respond, and we found them very valuable as they did respond. So the haste around it was just to make sure that all our issues are aligned. Because if we were today going to say to you, we're still waiting for comments, public comments, and we still can't tell the manufacturers to release the vaccines, you would be again very upset with us to say, but why delay? And I think that we have to try and balance all of these issues. So though we do understand that people must have 3 weeks, 3 months to comment on some of the issues. Some of the issues come a bit fast, and so I think we need to really plead for your understanding there. Of course, the public has got a right to comment, and they did comment. And I want to say, as they commented, we actually appreciated the comments. These comments are very, very important for us. And this is the thrust of our own democracy, to say that we want to know what the public thinks. And they did make us understand. And we did talk about them. I must say that they were actually all well thought out comments, and they were very helpful. And some of them are issues that we may agree with them, even if we don't have much to do. We may not have much to do to change the situation. So from that point of view, I think we mustn't in any way doubt that we have appreciated those comments, even if it was within 5 days. Then some of the issues will be publicized when we announce more details about the fund. For now, we just wanted for everyone to know that there will be such a fund, and then the details, we will make them public. So some of the questions you ask about people, how many people will serve and all of that, will come through at that point. It will come in directions, and it will not really, it didn't need to come out in the earlier regulations that were gazetted. So that will still come. Other question is, will there be, will phase 2 start when phase 1 has not been concluded? Yes, indeed. We do expect, though, that there'll be vaccines before the date of phase 2 starts. We still expect that if there are people on phase 1, the healthcare workers will still be needing to be vaccinated past the 17th. That will continue, but it won't stop starting with the phase 2, because we will have enough vaccines at that time. So we don't think that's going to be a problem. So if you look at it now, we expect that in the first 2 weeks of May, we would have received close to 600,000 of the vaccines. I said last week that will be over 300,000 each for each week for the first 4 weeks. So there'll be enough vaccines to start and do phase 2 whilst we're doing phase 1 at the same time. There's also going to be enough Johnson & Johnson vaccines as well. The question of the permission, everyone who had to do the vaccine has to kind of give a consent. The vaccine has to always have a consent. It doesn't matter which one. In this case, we are going to be asking people just to sign a consent. It doesn't have to be a long, big, thick set of forms. It's just a matter of saying you are aware you are taking a vaccine, and therefore you are agreeing to that. And it has been asked for before. We have asked that they must just re-sign it this time around, just to acknowledge the fact that there's been additional information about side effects to watch out for. So that is why. The question of the pregnant and lactating women is a precaution again. We have said that both our regulator here and has been asked to make comments, and have given this guidance. I have said at the beginning of this presentation, we have asked that the ministerial advisory committees and the Society of Obstetrician and Gynecologists must debate the matter, because it's also not like it's a universally agreed position. It's as a precaution, and whilst the scientific research is being evaluated, that we need to take that precaution. So we continue with that precaution, and the reasons for it are that they just need to establish the safety on those categories of women. This arises from the fact that most of the studies have been done on people who are above 18 and above 18 and above, and therefore certain areas such as the impact on newborn babies or fetuses and so on could be issues that they might just want to look at. And so that would be the reason. Then what if India collapses, South Africa gets 300,000 overnight, with South Africa cope? Now, you see, honorable members, now we mustn't try and bring too much panic into South Africa. We have been through very difficult times in the 2 waves, and therefore it is not possible to suddenly overnight wake up with 300,000 people. It won't happen like that. It's going to build up over a period. And as it does, we will also be matching our response to the rising numbers. So let's just trust each other. We've gone through this problem before. It's been very difficult in the last surge, but in the first instance, we'd made a point that we wanted to make sure that our beds, our staff and so on are ready. And so we also indicated that it becomes important for us to have a short response time in the event that there's a need for additional services. So we will respond in the same way. We're anticipating that there will still be a wave that will come through, not to the extent of 300,000 overnight, but nevertheless, it's important for us to say we are monitoring. As you have seen the numbers won't suddenly overwhelm us overnight when we've not been watching. We are breaking it down right to the lowest level. We've got numbers per ward in terms of how many people are positive. And on that basis, you won't be able to suddenly find a huge number that we had not anticipated, but you will be able to see as the time goes on. So that is the understanding that you need to look at. The Livingston Hospital, I won't be able to go into any details on that because we need to just go into a bit more specifics about it, but I don't have that as we speak. All I can say is that we do have a challenge. Most of the departments have had a budget cut, and therefore, even in our situation, we have to manage those cuts and see how we can deal with those. Many provinces have raised this issue of the budget constraint. We have to live within that, and unfortunately, that's the situation that we have to face. And we have to now work with the hospital to try and make sure that they can cope, even though they've got those challenges. The real issue is the medical legal bill. I have had a long discussion with the Eastern Cape. It's a major problem in the whole country, and as far as we can see, no province can deal with it alone. We all have to deal with it. I actually believe that the reason why I raised the question last week of the Norfolk Compensation Fund, that a similar fund needs to be put up to take care of medical legal claims, is there a real reason? Because you can budget for it and cap it and keep it within a particular level. Now, right now, medical legal costs are a runaway horse here that no one can control. There's a lot of exploitation of government resources, which we need to really stop at a certain point. And we must say that the only way to do so is to actually create a framework which allows us to cap the cost and the expenditure and level of claims, and also make sure that there's an easier way of people going through to get protection for in cases of mismanagement or negligence or any kind of problem, so that if they suffer any harm, they can actually go through that process without having to face exorbitant charges by lawyers, and of course a lot of extortion that we see to be happening through this fund. I'm very unhappy about it. I actually believe this is something that the government really must actually rein in and stop, because yes, people need to be protected, which I agree with, and I think people need to be compensated where they need to be compensated in case of neglect and mismanagement and so on. I think it's a very fair way of dealing with it, but it must be made simpler. People must walk into the office and say, I've been harmed and therefore I need attention. They must be assessed, and once they're assessed, they must be given due compensation, which is pre-established, and on that basis, they must feel that justice has been served. Now, this thing of this medical legal bill is really way, way, way above what really government can afford, and it's really causing a huge dent on the services that we have to render. It's unjustifiable. Nevertheless, because it goes through the courts, you can't do much. Quite often, the problem has to do with the fact that the records are lost, and the doctor who was there is no longer in the area, so nobody remembers what might have happened. All of those things are things that can be cured and be sorted out, and we're going to work on that. and make sure that it doesn't become a problem that's going to be ongoing. Then, when is the third wave? Will it be worse? Now, we're coming here, we have now third occasions have been given presentation on the third wave. In the first instance, we've indicated that we don't have exact timing as when it's going to happen. It can happen anytime because it's based on behavioral change. Secondly, we have indicated that the current models suggest that it won't be much bigger than the second wave, and therefore, still we're hoping that it may not be as bad. But nevertheless, no one can say for a fact we can predict it. And so what we will then say is that we're watching out for it. We're going to respond as far as possible as it arises. The list of vaccines, of vaccination sites, again, I think the chairperson can indicate to me whether you have, as members, received it. I've asked that you receive it. It's a complex set of spreadsheets that you should have sent to you. It's easy to open it up in a computer, but it's not for publication. It's not for the media. It's not for the public. We just want to answer the question to parliamentarians. Are you having these lists? Do you have them? And we're saying, yes, we do. But we're saying because there are too many, they've got lots of issues to clean up, we're not ready to publish. Once we're ready, we will publish them. So that list should be available. But please don't publish it because we're not ready for the publication yet. We don't want to answer questions of things that we've already changed simply because there were problems that we saw that needed to be changed. Then, Honorable Munyai, thank you very much for your support and appreciation of the presentation. Yeah, this question has been also asked by Honorable Kela. Is there a need for provinces to buy their own vaccines? The answer is there is no need for provinces to buy their own vaccines. If they did, it would almost amount to fruitless and wasteful expenditure because all the vaccines that each province needs have already been calculated in the total that we will be providing as a national government. We bought on behalf of the entire country, and in buying, we bought calculating the needs of these very same provinces. But we also did say that the provinces will not be able to go into buying for themselves because you would need deviations from Treasury. Now, Treasury has already given deviation for the health department encompassing everybody. So that's already in place, and it's not for provinces, it's for a national purchase arrangement. Secondly, there are deviations for prepayments, and again, you need authority of Treasury to do that, and they've already given that to the National Department of Health on behalf of all the provinces, and so there's no need to repeat that kind of deviation. Thirdly, there's a need for us to negotiate for large volumes from with various manufacturers. That has been done at a national level, and there's no province that can come with better volumes to get a better price to the manufacturing company than what the National Department has done. Fourthly, the question of sovereign guarantees and indemnities that have been put in place. No province has got authority to do that, and it has been done via the decisions discussed with Treasury, with the Interministerial Committee, with the National Coronavirus Command Council, with the Cabinet, with the Presidency. So it's a whole combination of government institutions that have to participate in taking these decisions. So there is not even a need for contingency. We have announced the numbers. Those numbers are actually destined to all provinces. Not most of those vaccines will be dispensed by provinces. They won't be dispensed by the National Office of the Department of Health. So they are actually for the provinces. So there's no need for any province to go and buy any vaccines as such. I have been in the Western Cape, and we discussed this issue, and I've made it quite clear to the Premier and the MEC that all their needs are catered for, and that there is no shortfall in their requirement. In fact, if they calculate how many vaccines they need, they're already in the batch, and so there's no need for it. But in addition, they then asked whether there was going to be any need to have any contingency arrangement. And that said, like, the amount of vaccines that we've already ordered are such that they are a contingency on their own. You don't need to buy from somewhere else. You must wait for the batches that are going to be distributed. And the heads of departments, as part of the National Health Council, are going to be sitting together to say who needs how many vaccines and they must get them. So every province will get as many vaccines. Private sector will tell us how many vaccines they need, they'll get them. We calculated all of that on the basis of the needs of the country, not on the needs of any specific province or private sector, but it's a combination of all of us working together. So I once again want to assure everyone that at the moment we've got more than 60 million vaccines purchased, and therefore they'll be coming through. On that basis, no part of the country will run short of the vaccines. When we put the additional amounts, which we're saying from Sputnik and Sinovac, that will take us to probably maybe 70 million vaccines. But that will, all in all, probably take us very close to 50 million people that will be vaccinated. And we're doing this because we're quite clear now that the demands for the vaccine will outlast the calculation of what was the original number for herd immunity. Of course, we're also aware that the scientists have been debating the question as to whether 40 million will be adequate. So we don't want to be caught short on this one. We will make sure that these vaccines are made available. Then Honorable Wilson asked the question, how many private sector transactions on the purchase of vaccines? The approach is going to be, right now, private sector is part of our national rollout plan. So there's a mechanism of how private sector will buy vaccines through BioVac and get them to their own sites. And these are likely going to be paid for by medical aid. We have had lots of discussion on this, and our team is finalizing the costing associated with it. So it will move from public to private, and then of course the private sector will then activate payment through the medical schemes. But there's also been a discussion for the insurances to be made available to the uninsured. We're also working through that. I had a discussion last Thursday with the Council for Medical Scheme, the Board of Healthcare Funders, who are then saying that they are looking at these numbers and we welcome them. And we have said that once they are refined, our team will give us a proper report. So medical schemes will be the base on which we'll actually get a lot of private sector payment of the vaccines. And there is also insurance of the uninsured workers. That is also going to be part of it. But anyone else who is not covered in those two will be covered through the national vaccine program that the government is funding, because those who can't pay for themselves, of course, the government has put money for that. Then Honorable Wilson is raising an issue about people who are accepted for jobs abroad, can't return to work, and so on. Of course, we only get this as a question from Honorable Wilson. We have not had to deal with it, and so no one has actually given us such a request, and so we've never really said to consider it. We've just simply explained how we're approaching the phases. So I would only suggest that if there's any such situations, we could then talk to, they could then give us something concrete so we can see how to apply our minds on it. The real challenge for us is trying to avoid queue jumping. On the one side, everyone is wanting to make sure that people get to be given a fair share of the exposure to the vaccine at the right time. But we're getting different people, different letters coming to say, please consider this group and that group. We have said we're dealing here with people who are going to be in congregate settings, in the frontline workers and so on. But we're saying within that group, of course, those who are exposed with comorbidities, with age. And so that's the 6 months what it's all about. So if there are concrete issues here, maybe we need to then get a formal request so we can understand whether we can assist or not. At this point, we just wanted to explain how we're approaching. The exceptions that are now coming are things that we have not had any direct request about. So if there's something concrete, then let's deal with it. It will be difficult to deal with it in generalities. Give it to us, let's see, because we don't know what the kind of work that the individual will be facing. It might be something that we can do something about. So that would be how I would deal with it. Then I think the DG would have to just attend to the issues where there's not enough data. So we will just make sure that everybody gives us adequate information. Then India, the issue around India, I think I have dealt with it, but I also don't believe that we should be getting frustrated by the fact that the issue of Sputnik and Sinovac is not finalized, because we've now said we've already got vaccines that are in place. We are saying we're also procuring more vaccines as soon as the processing is in place. Now, why should it be more frustrating when we've already got over 60 million doses confirmed, and you are concerned about the 10 that are not yet confirmed? And yet we're saying we're working together with the manufacturers, with the embassies on those particular countries to fast track this process. I've got correspondence now, because almost every day I'm talking about it to check where the situation is. The only other way of dealing with this issue, let me explain what tends to be the challenge. If the regulator needs certain information, we can't intervene politically to say ignore that information. We have to ask them to speed up the process. So the best we can do is to liaise with those countries to say, could we help this team to give us this information? So for example, some of the information that was asked from Sinovac, it's information that in a presentation, when people were discussing, Sinovac has the information, but the local agent did not have the information. And so they have to keep asking them to get us that information. So that's the kind of delay that we face. But we already have 63 million vaccines that are in the pipeline ready for use. Then these are also in addition. So that process, we will work through it and make sure that we ultimately get them. Our team is working with the WHO as well, so that we're aligned. If we don't have the information, we can get it from WHO, just to speed up the process of those two. They are our allies, and we have to work with them, and we really do want to do so. We're also not just looking at just the vaccines for this time around. We're also looking at future collaboration for creating more capability for South Africa to manufacture their own vaccine in collaboration with this particular BRICS partner. So we are actually quite interested in working with them. So even if there are delays, we'll make sure that those delays are attended to and they'll be dealt with appropriately. Then the Honorable Thenjigwayo raised the issues around India. I think I've dealt with that. And so we are concerned as well about what's going on in India and different parts of the world. But we will also be monitoring that nothing overwhelms us coming from India. And then we've also responded to the issue of the medical schemes, how they contribute to the cost of vaccines. They will pay for the vaccines, there'll be figure calculated, and that those who are on medical aids will get the payment to cost to pay for the vaccines, but we will calculate the cost and give them the global figure that covers everything about it. The question around payment for pharmacists, that again has been done. The figure that we're working on was probably close to about 60 Rand per person. That will cover the individuals, that is the staff that deals with the dispensing of the vaccine, the needle, the syringe, the swab, and so on, so that that cost is actually standardized. I want us to make sure that it is standardized so that no one is asked to pay an additional amount on top of what medical aid would have paid. And also want to avoid anyone being made to pay when in fact the government is already paying for it. So we just want to make sure that it's standardized. And so we'll announce it once it's, that issue is closed. Some were wanting to push it higher, and we're saying no, it must be kept at that level. And so I hope that you can close that. Then the next question around preference for Sputnik. I have responded on the issue of Sputnik to say that we are really working hard to make sure that we are able to get these vaccines. But when those vaccines will come, we need to make sure that the necessary registrations have been dealt with. As I've said, I've got the responses even of today. What's the latest? I almost 2 or 3 times in a week get updates because I want to know when do we actually get this aspect closed. I've actually said that the Director General should actually indicate our interest in purchasing so many vaccines from the Sinovac and Sputnik, so that whilst we're going through the processing, we're starting the negotiations at the same time. There are issues of prices here, which I won't go into, but we have actually said our team must work on those issues because the prices, we're going to negotiate everybody downwards, and I hope we'll succeed on these ones as well. The other question that is unrelated to COVID around the intents, this matter was referred to the Gauteng MEC, but what I want to just suggest is that the Honorable Tenjegwayo, if you can just write us the letter and give us the specifics, and let's see if we can investigate from our side, because we have sent the matter to the province. But if it comes as a general questions like you asked, we'll send it also as a general query to the province. And then if we don't hear more about it, we don't know whether it's been resolved or not. So in this case, I would request that if the honorable member can write directly to me, give me the names of the people who are involved, the hospitals in which they are, and then let me go and deal with it like that. Then we don't need to raise it. By the way, I see the member is frustrated that not getting the responses. Write it straight to me. Let me then deal with it from that point of view. But in the past, when we picked up the issue, I've actually referred the question to say the province must look at it. And so we will actually be now dealing directly so that we can actually follow the area of your concern. And of course, members do know that you are welcome to write to me the questions that as ministry, we will actually follow your issues up as well. If I may just then say, the question of the third wave has been raised by the Honorable Tenjegwayo and Honorable Jacobs. I think others have raised it as well. The first issue we've dealt with, and that is the modeling as to when that is expected. We've said that it's unpredictable, it's uncertain, but certainly we hope that we will have very strict adherence to masks and sanitizers and distancing, so that it does not come so fast and it does not come so strong, because clearly from the models, the determinant of when and how heavy is going to be on what is our behavioral change. If we are able to keep onto the non-pharmaceutical interventions, we can actually keep the wave away. But in terms of hospitalizations, as you have noticed in the presentation, we're monitoring that. And whenever we think that the numbers are going to be increasing, we will be increasing the numbers ahead of each of those hospitals so that we can activate some of the temporary structures if need be. But right now, we are monitoring. There's no need for us to actually increase the numbers of beds, but we will have beds available in the event that we deal with it. I think the one lesson we saw in the last wave, the second wave, was that the confidence amongst our staff is such that even with a very heavy bout which we went through, there was no panic. People knew what to do because they are very experienced now in dealing with COVID. And from that point of view, we will actually be monitoring all of this. We monitor the numbers of people who are positive, we monitor the numbers of tests that have been done, we monitor the numbers of people who are presenting, we monitor the numbers of deaths, both direct deaths that are reported, as well as those what we call the expected the expected deaths on the other side. We monitor everything. And so our hospitals will be focusing on that as well. We'll also have to deal with the issues of staffing. Where there's need, we actually make contingency measures to increase the staff to match the need that is arising. Oxygen, the same way. We've actually got oxygen to be set up in a number of hospitals which didn't have oxygen tanks before, mainly to prepare for this. And so we will also be moving ahead to predict where the needs are going to be arising so that we can make the oxygen available, as well as the emergency medical services. They'll also be put on the alert. We do prioritize when it comes to the COVID situation, and also if need be, we have to actually limit the numbers of elective surgery, elective operations, and admissions that can be treated at home. We do a lot of things to try and make sure that the situation we're in does respond. Of course, we're working from a base of a very compromised health services, because there's a huge need for infrastructure, for human resources, for increased budget, for literally a lot of issues that need to be corrected. But that doesn't mean that in the absence of that, we are not able to respond. We will respond as we would have done in the first wave and in the second wave. So we will continue to respond as such. So the concern, therefore, that the members have, will just be assured that we are actually looking at the matter as well. Honorable Kela raised the question about provinces buying their own vaccines. I have responded that there is no need for that, and I've explained it directly to the Western Cape that they don't need to actually be worried about that. They should spend all their resources in logistics, in ensuring that there's adequate training, there's adequate provision of staff, so that people will be vaccinated as soon as the vaccines come. The last thing I would like to see is a situation where we've got vaccines sitting in the fridge and they cannot be dispensed because our system is too slow. So my, excuse me, my point to the rest of the provinces is that when the vaccines come, they must go into somebody's flesh immediately, so that there don't be a delay. Now, Pfizer has indicated that they'll give us 300,000. 300,000 can actually be disposed of within a very, very short space of time. And therefore, we expect them to match up to the supply and make the provision available of these vaccines available. The question that the Honorable Jomo has raised, yes, indeed, you raised certain questions, and we did, address them in terms of some of the unreasonable demands. And of course, the matter took quite a lot of public interest. And when we discussed with Johnson & Johnson, it was quite clear that at that point, we had an understanding that there was no new preconditions. And so the contract was signed, and they've actually indicated a lot of interest in further investments in South Africa to expand our capacity for vaccine manufacturing, and we welcome that. And we believe, therefore, that we had already demonstrated adequate support for any inbound investment in improving our capacity to manufacture vaccine, not only for Aspen, but for BioVac and others. And this is in line with the decision of the heads of states in the African Union, who have said that the continent of Africa must not be left behind to deal with future emergencies without capabilities that are a part of the continent. As you can see now, the vaccine nationalism, when the US says you will only vaccinate in the US before you distribute to other countries. We've seen some of the countries such as Germany making huge statements of that effect. We've seen the challenges in India. Certainly the African continent must on its own have its own capability, so that we don't have to rely on what other continents might be looking at when they're feeling under pressure, and they obviously prioritize their own citizens. So this is a basis on which we have to actually encourage more of the current manufacturers to be party to the partnership that we have to be involved in South Africa. Then we have responded to the issue of Sinovac and Sputnik, and also the question of assisting the elderly. We have said that community health workers will assist where possible, but if not, we'll just simply get them to the vaccination site, and then they'll be registered on site, and so there shouldn't be a problem. The risk of thrombosis is much lower, as you have indicated. This phenomenon has happened in 1 in a million times, which is really considered to be very, very low risk, which therefore means that we should not discourage people simply because this has happened. We still have to analyze what are the factors that are associated with this. It has been known that about women aged between 18 and 48 were affected. As to what else was underlying in this, we don't know. And therefore, we would just need to make sure that further elucidation comes from scientific research. But in particular, at this point, we must say that that risk remains very low. People must continue to take the vaccines. We will also be encouraging leaders from various sectors to come forth when we start the second wave, second phase. For example, religious leaders, church leaders need to come forth and be seen to be vaccinated, just to allay the fears amongst the congregants that this is a safe exercise. We need to ensure political leaders, party leaders, parliamentarians, MPs, councillors must also come in the forefront so that they can actually assure the public that there is no need to fear the vaccines. Business leaders, leaders in civil society, traditional leaders, traditional healers, sports, and all different levels of leadership need to be in the forefront when we actually call for the next phase, so that people must understand that even their leaders actually have subjected themselves to the vaccination. President Ramaphosa actually was amongst the first few to take the vaccine, and I think it was important to send a strong message to say that we need our people to be protected through the vaccines. That is where we would like to leave it. Chairperson, thank you very much. At this point, we'd like to bring it to the end. Thank you.
Okay. Okay, thank you very much, Minister, for that very elaborate response. I think we missed recognizing Shengwa. Mam Shengwa joined in while we had just completed the recognition of members. She had a challenge with the connection, but she's now part of the meeting. I would like to then say there's been only two specific requests, one each. One follow-up from Honorable Wilson and Honorable Van Staden, and each have indicated they would like to make one follow-up question. Can you do that, Honorable Member, so that we can proceed to other issues thereafter? In that order, Honorable Wilson and then Honorable Van Staden.
Thank you, Chairperson, and thank you to the Minister and the DG for the report and the responses. We appreciate the response on those, and I'm not sure why the queries haven't come directly to you, Minister, but we shall direct them directly to you and to the GG with regards to people who have got work to return to, or contracts or study. Obviously, they must be able to, and we don't want anyone jumping the queue either. Please, I'm in that queue too. But you know, there are genuine concerns, and sorry, I'm just going to turn off my video because I see my light is very bad. So we will direct those, and we have made it clearly understood that there will be no queue jumping, but if somebody has a contract and visas have been applied for, etc., that, you know, these are situations that must be considered, and we appreciate the fact that you have given us the go-ahead to submit to you and get consideration made. My only concern, Minister, and it remains a big concern because we know of large national or multinational companies who have offices or are based here in South Africa, who have requested from us information on how they can buy vaccines directly to vaccinate all of their staff. Now, understanding that all of their staff are not all over 60, not all of them have comorbidities, and obviously are not all health workers. But I think the question here is our vaccine rollout is exceptionally slow. It's exceptionally behind. It's all very well to talk about the purchase of 60 or 70 million doses, but people want to be vaccinated now. And if a company of that magnitude is in a position to buy a vaccine that is obviously accredited by SAHPRA or has gone through the various stages and has the approval by SAHPRA, I don't understand why it is that they are not allowed to purchase directly. The point of vaccination is number one, to protect our people, and number two, to create an immunity. And if somebody is able to do that without having to wait 6 or 8 months and leave their staff at risk leave their people at risk, and they can protect those people now. I still do not understand why this cannot be acceptable. I hear what you say, that the private sector must apply to you. Well, that's 6 of one, half a dozen of the other. You get the vaccines, you know exactly where they're being allocated to, you know which provinces they're going to and which sites they're going to. Medical aids aside, when we're talking about private sector, we are talking about multinational large companies who are in a position and who are willing to buy vaccines directly in order to ensure that their people, their staff, their workplaces are protected. And so I really have a serious problem with this. Thank you, Minister.
Honorable Van Staden, are you there?
I'm here, Chair. I was just wondering if I can continue, but thank you very much. Today is actually a good day for me. Thank you, Minister, for all your answers to all my questions. I appreciate it very much. I just want to follow up on the compensation fund. I'm just worried. I hear what you said, but you were not ready to publish the regulations earlier this year than predicted. Therefore, in my view, because of that, the democratic process for public input was a bit undermined in this regard. And we must ask each other the question, is this really the way to handle business in such a very serious time or period which we are currently in South Africa in this pandemic? And I hear what you said about the 13,000 responses that you have been received, but it seems like these regulations are been sneaking at the back door. And therefore, Chairperson, I would like to see that this committee be given feedback every month, at least, about this compensation fund, and the Minister must come and report every month about the administration of this fund, so that we as MPs can fulfill our oversight role in this regard. We must be keep up to date what is going on in the administration of this fund and how the money will be spent in this fund. Thank you very much.
Okay, that is all. Honourable Minister, you can then close that response.
Excuse me, Chair. I did raise
Yes,
my
Honourable
hand.
Dr. Tembekwayo.
I just wanted to say to the Minister, I did forward all the relevant information in connection with those internship long time ago to the referred people, to the DG, to the Deputy Minister, to Mr. Kratla and everybody. So I can't be able to go and rewrite and resend the information. Let them be able to inform the minister and do as they requested and make some follow-ups and come back to me. Thank you.
Okay. Yeah. No, thanks. Fine. The minister might comment on that, but I thought he was meaning that when we make requests or questions on issues related to a specific and a province, then the minister will write to that province and say to that province, please furnish me with this following information that I need to process. That's how I was probably reading his response, but he will answer to that. Thank you.
Thank you very much, Honorable Chairperson. Yes, Honorable Tembekwayo. I will follow the issue up internally on that. Certainly, whilst I've not been aware of it, in terms of the specifics, other than the general question that you asked, I will follow it up to see where the matter would have been gotten stuck. And certainly, if you have already done so, there's no need for you to do it again. What we'll then do is just to check inside. Now that you have given me what has happened, because I'm answering the question here, I haven't really got any specific feedback. I will now check with the rest of the team, and we'll get back to you on that one. If it's got specifics, then it's easier to deal with. If it's general, I think we need to move beyond that point. So if you have done so, then that's fine. The other one is the Honorable Van Staden. Honorable Van Staden, I disagree with you. We haven't undermined the democratic process. the fact that we did go out for public comment has been actually an important thing for us. Whether if you requested for more days and we couldn't afford them, that does not mean that the democratic process has been undermined. If you are concerned about what happens in the future, I have indicated there will be directives, directions which we will issue. There will be reports which we'll bring to your committee. We'll certainly account for them. So there's no problem on that point. So I don't think that we should actually make a statement to the fact that there's an undermining of a democratic process, when in fact, if you woke up and found there were regulations and there was not even any public announcement, then there would certainly probably be justifiable. But at this point, I think your statement is unjustifiable. The question of having to report back to the portfolio committee is correct. I think we need to do that. And certainly, even ahead of time, we could indicate areas where you think you want us to make sure when we respond, we're able to cover, we'll do so, we'll cover. But at this point as well, let me say that the Norfolk Compensation Fund is our decision, it's our institution. So we will actually deal with it, not so much as an issue that's been thrown at us. It's an issue that we believe it's important to refine for purposes of protecting our people. So your comments on that on an ongoing basis will still be welcome, because we're doing something to protect our people. So on that side, we're together. Where I don't agree with you is that we've undermined democracy. I think we fought too much for us to actually be seen to have undermined democracy. At this point, I think you have the right to have your views. I have a right to my views, but I don't agree with you. But I think that there is a need for us to go on into ensuring that you continue to make inputs into this in this situation. There are people who have got huge disagreement about why we went ahead on this issue. Not because they say it's wrong, but they're saying, why did you let the manufacturers get out without putting any money into this? I think at this point, protecting our own people is a lot more important, and therefore, that's the point that I think we need to really focus on. And your comments about what else needs to be done in the administration and the way of concerns, certainly I think that there's space for that discussion. Then Honorable Wilson, well, where it's difficult where we are, where we get accused whatever we do. We get criticized whatever we do. In this case, we have been trying to make sure that South Africans are approached on an equitable basis, so that you don't do any special considerations unless there's a justifiable reason for it. And so if you were to share with us, we'll be able to see whether we can assist in this situation or not. But our biggest concern is that we can't issue into different things, because now this matter is being raised. Now we must change things for people who may not necessarily be deserving any specific change in their approach. So we will have to look at that matter that the specific individuals are raising and try and attend to that. Those instances will arise when there will be specific consideration and depending on the case by case, but we can't answer it as a general issue. So we're happy to receive from you the question of those specific ones, so we know how to assist if we can do so. The other question around the multinational companies, maybe let's put this issue slightly differently. When we approached this issue of the vaccines, we embarked on it as a national program, which is for all South Africans. It wasn't a question that we thought would be fair to say, well, for those who've got money, let them go and buy the vaccines. That's the approach that we've taken, an equitable approach that says, let's get South Africans to support each other, help each other to make sure that they get, a vaccination. Now, there is no problem with me if a company decides to go and buy vaccines somewhere else on their own. But if they wanted to work with us, then we'll sell them the vaccines. We'll get the vaccines available to them. But vaccines will be available in the context of what I've just indicated. Medical schemes, insured workers, then any multinational company can actually come in at that level. And we've got the whole NetLeg team, Business for South Africa, helping us on that side. But you are raising a slightly different issue, which I just want to try and clarify as early as now. We would not stop a multinational or any company from going out to buy their own vaccines. We will not stop them. When we explained that this was a national program, we're basically saying we want to work with everybody so that we can go through to vaccinate as many South Africans as possible. But any company that wants to go and buy vaccines, we will not stop them. But here are the issues. Firstly, there can't be a cross protection on the demands of the multinational, on the manufacturers, extended to someone who goes to buy their own vaccines. We can't, because the issue is we would not be party to that transaction. Right now, these ones, they're going through a lot of rigorous evaluations of the quality, so we know that there's no fake vaccine that gets introduced here. We know that there's no risk that is there to our people. But we can't then vouch for anyone else who would have done so. If they did so, they'll have to do that under their own responsibility. Secondly, when we say that there's a Norfolk Compensation Fund, it cannot cover anyone who's actually been vaccinated with vaccines that are not part of the scheme that the government has just spoken about. Again, we cannot vouch for the safety and the quality and the authenticity or the anything that's got to do with anyone who would have vaccinated. So that company will have to be to deal with that on their own. And I've checked this across different countries and institutions. I've asked COVAX, when you do your own vaccines and you make them available into a country, will you cross-cover anyone else who's in that country who's actually been vaccinated outside your COVAX supply? They said no. So there's a specific issue here about who this Norfolk Compensation Fund is going to cover, because we cannot be sure what actually they got. We are not going to be able to do so. So those are some of the issues. What we actually were aware of is that most of the major companies, they actually are trying to sell to governments because of the volumes and the guarantees that they require. But you can't get a government guarantee based on a certain number of people who are recorded and registered as having been vaccinated. And then we suddenly get a claim from someone who's got nothing to do with that system. So that's the risk that we were worried about when we said, let's try and work together. But no one can stop anyone from buying their own vaccines anywhere. And government does not need to get involved. And if anybody wants to go and buy from outside, there's no problem with that. It's not, but government can't be pulled into that system. What we have been explaining is that government will procure and private sector will work with us, and that is because of the national collaboration that we have actually established. So it is not to say you can't go and buy your own stuff anywhere. There is no problem with that. But the question of being covered through the Norfolk Compensation Fund becomes an issue, because then it's got to be based on who is on our EVDS. We're not going to be able to register someone that we don't know. We've actually already seen fake vaccines coming in. We don't know what is happening there. We have said that government must manage the whole thing so that we can avoid the development of a black market in this whole situation. We have said that government must manage the costing so that nobody gets to be paid extra, so that you don't create a new parallel market on the vaccines. We're doing that mainly because we want to avoid corruption, but also want to protect our people. And so if anybody were to go all out and buy this, if there was a misunderstanding as to what we're saying, we're now saying it must be clear that anybody can go and do whatever they would like to do. That is fine. But this system is defined as what we're indicating here. So my advice would have been to the private sector is that let's work together. We have secured enough vaccines to cover a lot of people in South Africa, but they may not necessarily all be covered on the same day as we all want. All of us would like to get vaccines on day one of the arrival of the vaccines. It won't be possible, so we need to then work together on trying to schedule how quickly we can make sure that all those who need vaccines can get, and those who are at risk. It's going to take us, as I've said, close to a year to deal with this. And because of that is the availability of vaccines, right across globally. That's really what is causing the challenge. But it does not stop anyone from going to buy their own vaccine. But if they do, they've got to they've got to adhere to the rigid regulatory framework that is guiding this whole process. So I'd like to make that clear. But I don't see that any of the private sector, the major companies, can actually not be able to get the vaccines if we're to work together. We'll probably have to schedule with them as to how we get the vaccines through. The vaccines that we've got are already inclusive of all the South Africans who are in various industries in South Africa. So that, for me, is what's going to be important to say, yes, the vaccines are available, not exactly at the same time. But let me also say, we've given you the numbers at this point. It's not so true now that it's only us who know when these vaccines are going to be, how many of these vaccines are coming and what dates we're expecting. Those dates that we know, we make them public. So it's not like there's private information that we've got. We've got information, we share it when we have it. So what we don't share is what we don't have. And it's going to happen like that for many times, because there are many instances that the private sector won't be able, the manufacturer are not able to give us concrete information. If they haven't given us, then we won't announce. But when they give us, we'll share it publicly. It's your information, it's all of us' information. We need to all be aware, because we need to cooperate with the process, and we need to really get everyone to be up to working on this process. If the particular companies would like to come and meet with us, we would be very happy. You could facilitate that they actually come. Let's discuss this issue so that they should be aware as to how we're approaching it, and they must not feel that they are being stopped, because we won't stop them. When we say it's a national program, we're just explaining how it's going to run, not in terms of no one else will be allowed, but there are complications if you go out on your own. So I think we need to understand that, but we can share with them, and we've got a number of forums where we can actually bring them to, so that they understand how we're working with those private sector that are already part of the program. I just want to plead that we must just cooperate together on this, because there are enough vaccines ordered for everyone to be able to access as part of South Africa. Thank you very much, Honorable Chairperson.
Yeah, no, thank you very much. Thank you very much, Honorable Minister and your team. From me, the education that I got today and the information that at least we have got more than 60 vaccines confirmed available, most likely will go right over your population herd immunity that was scientifically projected, and that we are also restarting the vaccines today. And also there's been a process to focus on the elderly and over 60, and that no one will be turned away at the site of vaccination if they have not registered, but will assist. And we are also taking away the anxiety from us as South Africans about the availability of vaccines. What may remain still an issue is the pace, and maybe when do I get into the queue? But we will really request South Africans to maybe follow this arrangement that has been outlined, because the risk is much greater on my grandmother and my grandfather than it is to my teenage daughter. So maybe if we can look at that. And maybe you will also note the compensation fund update that I'm sure you continuously update us on. With that, Honorable Minister, we thank you very much with the delegation, and hope that our team with Ms. Majalamba, Mr. Khatla, will continuously get us a slot again to get us update. You remember we asked if there's any other important updates in between our slots. We need to probably get your Mr. Khatla send us that information early so that you can also join. Thank you very much, Minister. Maybe your last comments, and then you could then exit.
No, thank you very much, Honorable Chairperson. Let me just say to the members, if there are issues that are outstanding, please work with us and assist us to get that direct information so we can deal with the issues even before the next meeting for the members to have their answers. Thank you very much.
Okay, thank you very much, Minister, and your team. You are excused. Could honorable members remain behind just to deal with the minutes, please? Okay. Honorable members, I would like to start with one matter. I have received a letter of complaint from SAPRA about two honorable members. I will forward this letter to the honorable members indicated in the letter, and have requested a process of how to handle that matter. I've since spoken to the House Chair as to how to handle that complaint from SAPRA. We might report to you if there's a need, but for now, I will then just forward it to the two members that are mentioned in the letter, and then we are going to start a process of re-looking into that matter according to the advice I received from the House Chair. If then we could pass, Ms. Machalamba, get us the minutes. I think we heard there are two sets. Sorry for last week. I had two weeks ago, I was not aware we had got two sets of minutes, and I thought we had finished, and I sent my goodbyes, and there was still one outstanding. Maybe you start with those, Ms. Machalamba. This was a minute. We had two issues. One was an update by the minister, and then our discussions about the constituency work and update on NHI. Note, look at that and check if your name is there, and go past Ms. Lindokuhle. Okay. Honorable members, these minutes were the outstanding ones that we have had a long time with them. And may I then call for members who would like to comment on it or call for adoption of these minutes? I will guide it by a voice name. Any mover for the adoption of these minutes, honorable members?
Chairperson,
Honorable Kela?
I move for the adoption of the minutes, but I just want to check which are those members, as you indicated that there are two members that SAPRA is complaining about them.
No, this is an open, okay. No, I'll write that in our chat group. But I've decided, we hope it's
not me.
Yeah. Mover for adoption of minutes, Honorable Kela. Any seconder?
Sokacha seconds, Chairperson.
Honorable Sokacha, were you present in that meeting? Yes, you were. Yeah. Welcome back,
Yeah.
Honorable Sokacha. Yes, welcome
Thank you
back.
very much.
Thank you very much. Yes.
Thank you
Let's
very
move
much,
to last 2 weeks ago. We had another minutes. Those ones were just straightforward, the update on the minister like we had today. Look at your names and check if you are present, and therefore we'll see. Hello. Yeah.
Chairperson, we can't hear you at all. You're muted.
Oh, yeah, look into the resolutions. That is the main focus for what we actually agreed upon, and we are getting those updates, Sputnik and Sinopharm. But again, honorable members, I wish you to read the number 6, that your unavailability for parliamentary work, that is coming back again, because we are going to have a long parliamentary work, and we will not afford not to do some parliamentary work We just have to adjust and really make sure we work very hard for our political parties, for election process, but also have so much to do with this. And I think this is the minutes where Honorable Van Staden was not there, because he also has made a special request that you must visit provinces. So do that, honorable members, we have to find time. So I'm just raising that as part of the discussion that we did on 6th, that I'm going to be still sending requests to you to consider sharing your constituency period to work with this parliamentary work. Any mover for the adoption of these minutes, honorable members?
Chair, again, I move for the adoption of the minutes.
It's only Honorable Keller who attends these meetings and find these minutes to be credible enough. Honorable Keller, I welcome your mover. Any seconder? And I may rely on Honorable Sokha at this time, was not in the meeting. Why do we have it difficult, honorable members, to accept the minutes? Is it something to do with something else I don't know?
I second, Chair.
Honorable Jacob seconds the minutes, yes. Honorable members, that brings our meeting to a close, but let me just say, for now, I choose not to divulge the names of the two members who were actually complained about by SAPRA. I will liaise with them directly, and I will work on the process that has been suggested by the House Chair. We may just report to you the outcome, but we should find a resolution thereafter. The point is that in this platform, because we are honorable members and we are an extension of Parliament, you can raise an allegation about someone and not prove it. But in Parliament, when you do raise it, there are certain rules. Here, we will be able to work on it and adjust accordingly. So it is just that matter that we need to go through it together with the members and SAPRA, and we will find an amicable solution to the matter, I suppose. Thanks. Can we then agree to bring the meeting to a close, and maybe we will meet again? There's a marathon of meetings, honorable members, starting on the 4th of, which is almost when it's next week, the 4th of May. Ms. Machalamba, do you have that? Can you just remind us, or maybe you can say it out of your head, that the 4th, the 5th, and 6th, we're having a marathon of meetings as a portfolio committee. Honorable Ms. Machalamba?
Yes, Chair, on the 4th, we are meeting with the FFC, the AG, and the MRC. On the 5th, it's entities, 5th, 6th, and then on the last day, it's the Department of Health, which is Friday. So we are meeting from Tuesday up to Friday. Thank you, Chair.
Honorable members, do try and find a very good spot where you may lose connection for a very short while, because it's almost a full day for the 4 days, and that will be in preparation for the budget vote part of it. So we really request honorable members that you are available the whole week long. In fact, that is the start of Parliament, but we start on all those virtual meetings. So all those meetings will be virtual. Yes, thank you. Any other comment from any other member? No.
Yes, Chair.
Hello, Chair. Hello, Chair.
Who's that? I see a hand of Van Staden, Honorable Van Staden, and I hear another voice in the background.
Yes, Chair, I raised my hand, Sheikh Imam, but I'll speak after Van Staden if it's okay with you. Thank you.
Okay. Yeah. Okay.
I'm second, Imam.
Okay, now I'll continue. Now, Chair, this meetings for 4th, 5th, 6th, and 7th, I presume it's starting, will also start at 9 in the morning, if I'm correct, just to make sure.
Ms. Machalamba?
Yes, Chair, the meetings will start at 9, except for the meeting that will be on Thursday. I can't remember the date. That meeting will start at 8 to 10. Then we'll take a break so that members can attend their party caucuses, and then we'll resume later after the House. Thank you, Chair.
Yes. Yeah, no, that is true. All meetings next week will start on the 9 a.m., except for the meeting on the 4th, because it is a caucus for parties. We were not aware whether there will be, but in the event there are, but even if there are no political party caucuses, we will not want to block that space. So we will start on Thursday, the 6th at 8 o'clock, and round up around 10 o'clock, available for our party caucuses, or not even have a meeting coinciding with that slot, and then resume at 1 o'clock with the rest of the program. Yes, that is true. Thanks. Honorable Imam Sheikh.
Yes, thank you very much, Chair. I think I just missed the part where you alluded to on the issue of the letter and response from SEPRA. However, I want to raise my concern that correspondence is being sent, Chairperson, through to SEPRA, and deliberately they choose to respond to certain things and not the others. Like I've written to them requesting them to provide any information on whether they're aware of any side effects or serious side effects or deaths that have occurred, which has been reported to them. To date, they have not responded. I then also asked them, if you remember, Chairperson, in a committee meeting, I also asked them a question, Chairperson, in terms of the question that I actually raised with them was in one of our meetings that we took.
Honorable Imam Sheikh, we are not aware of their responses to you, and if they are not satisfactory, we will then have to make a follow-up. So we are just shooting in the dark. I was not raising a discussion because I don't know what they have responded to you and what they have left out. But if you do feel that they've left out, you know how to handle that part. But if you need an assistance of the chair, I'm more than available to do that. But let's not make it an item now, because we're not discussing them. I was just reporting that there are 2 honorable members I'm going to forward their complaint to, and I've already asked the House Chair to assist me how to process that when there has been raised in that fashion. Okay.
Thank you very much.
Dr. Susan, did you say something?
Yes, I raised my hand. I just wanted to find out from you, Chair, to say, how far are you with inviting Honorable Floric to, Floric to our committee? You know why? Because as things are going, I just feel that as a committee of the Department of Health, the way things are done, the way questions are asked, we will never be in a position where we can be able to hold an entity appearing to our committee for accountability. We'll never be able to can do that. So I still support the fact that maybe that request must just be done, and so that we can know exactly what is it that we can do. Because in other instances, all other people will say, we appreciate something is very good, even something when it's not good. It's about being good and on matters that are not good at all. So please, I just would like you to continue asking for intervention on that regard.
Okay. Thank you for raising that part. I was not able to respond to Honorable Frolic when he asked the question specifically. I wrote to him, but then he called me and we had a meeting. Specifically, what would the members want me to talk about? Can they be able to furnish me? Because I would hate to come to a meeting and then have to shoot from the hip. What are the things that I must come and address in the meeting? So I was not able to, because you probably were very conservative, honorable members who made that specific request. What are the specific issues that he must come in and speak to? And he's saying for him to come to that meeting, he needs to be well prepared. He's not really hoping and confident that he will just come into the meeting and then be able to engage without having a prior information, what are the things to be addressed. And then he foresees a situation where they need to come to us twice. First time is to come and listen. Second part is to come and respond. Then we can fast track that ourselves by indicating what are the things that is. So I would request honorable members to then indicate what are the issues, not in this platform, maybe in a different chat group, as to what are the things that he must prepare to answer, to talk to. It may not be exhaustive, but I have no clue exactly in terms of details, and the members here can then indicate that part.
But can I just say for a second, Chairperson, to say, like you were saying, coming 2 times. For the first time, we don't have to know. Say, for an example, an entity is coming to present. We as a committee don't have to know that Mr. Frorik has joined, so that he can observe our responses. What is it that we do, and so on and so on, so that when we engage him, he has a view or a clear picture of what is happening in the committee. I mean, you as a chairperson are able to ask, questions to the point and everything. You don't beat about the bush, but the other committee members under you, definitely, they don't do like you are doing. So it's better if you can just unannounced, just drop in.
Okay, I take your suggestion, and I will really make sure he makes his time available to really be part of us. Thank you very much, honorable members. Can we then adjourn this meeting for today and meet you on the 4th or any other day if there's another urgent meeting before the 4th? Be ready for that heavy week of meetings. Thank you very much, and have a good time.
Thank you very much, Chairperson.
Yeah, but my dear sister, thank you.
Thank you very much.
Be back full time, Honorable Sokacha.
I hope so, my brother.
You're welcome back, my brother.
Thank you, my sister.
Thank you, Chair. Thank you, brother. Welcome you back.
Thank you very much, Charmaine.
Charmaine.